guys, good morning. This is Dr. Jenny, a physical therapist and Doctor of Physical Therapy, creator and founder of Balance and Pulse Support Group in Aging Adults, and certified exercise expert in aging adults. I'm the current vice chair of the Global Health in Aging, special interest groups in the Academy of Physical Therapy Association. So welcome. If you are in United Arab Emirates, Saudi Arabia, Salam Alaikum and marhaba guys. And if you are in Philippines, mabuhay and magandang gabi. So today we are so fortunate to meet and introduce another innovator, entrepreneur, speaker, and clinician. So we have an opportunity to have a wonderful speaker. He we have Dr. Mike Studer. Dr.
Mhm.
Mike Studer, welcome. So Dr. Mike Studer is a doctor of physical therapy. He's a physical therapist, master in health and science, and certified in weight trainer. He is a fellow of the Academy of Physical Therapy Association and also a board certified clinical specialist in neurology. He has many leadership roles. He used to be the chairman and the vice chairman in the Academy of Neurologic Physical Therapy, Geriatric Physical Therapy, awarded as the best clinician. We will not end here, Mike. So he was the best clinician 2011, awarded by Neurologic Physical Therapy, and 2014 by the Geriatric Physical Therapy. Really an inspiration for all of us and a motivation. He had more than like 30 articles co-authored and authored more than 30 articles, and he is a physical therapist and a great clinician for more than 32 years. So we invited him today so we will learn more about his challenges, why neurologic physical therapy, why of all the specialization, why neurology. And he had a wonderful TED engagement. He's one of the speaker in the TEDx, and he discussed something about neuroplasticity. Without further ado, let's get to know more. Dr. Mike Studer, we'll call him Mike. Welcome, Mike.
Thank you. Welcome, and I appreciate the invitation. Dr. Jenny, I'm looking forward to talking.
Wonderful. Thank you
Thank you.
so much. This is my first time to do an interview doing a treadmill. See, guys, how he needs to be active. One thing very unique with Mike, he never missed running every morning, and he only missed one to take a break when he did the marathon last 2017, right, Mike?
That's correct. Yeah, otherwise,
Okay.
my running streak is alive.
Yeah, Mike, what did I miss about my introduction for you? Can you tell us a little bit more, whatever I missed? I know I did um, discuss already your speaking as a speaker, author, and mentor. And I think what I missed is that you founded the Northwestern Rehab Association or Incorporation. Can you tell us more about yourself, Dr. Mike?
Sure, sure, absolutely. I proudly did earn the certified exercise expert for the aging adult, and was able to serve as an instructor for that as well. So as far as credentials, we were yet to cover that. You are correct, Dr. Jenny. In 2004, I founded Northwest Rehabilitation Associates. So that was meant to be a clinic that was going to provide innovative outpatient physical, occupational, and speech therapy. So I operated that as president and co-founder for 18 years, and then sold that in November of 2020. And so I still work for that same entity as a physical therapist, as well as a consultant. I really don't think you missed too much else. Then I was born in Iowa, moved out to Oregon, and here I am now.
Yes, yes, I missed that you are in Oregon, and then, but I also emphasize everybody that Mike is a wonderful speaker and contributor in MedBridge. So he's focusing more on neurologic and also geriatric physical therapy. All right. So can you tell us more about your experience Mike, why of all the specialization that we have? I am specialized in geriatrics. We have many colleagues in orthopedics. What interests you to go further in neurology or neurology?
So, Dr. Jenny, that's a great question. Back in 1987, I was engaging at the University of Missouri to begin what I thought was going to be a college education that would lead me to get back into professional baseball. So I was a lifelong baseball player, even walked on to the team at the University of Missouri where I went to school. And while I was unable to make the final cut for the team, I was looking for a way to get engaged with professional baseball. I was then attracted toward physical therapy as a route to get into baseball. When I went into physical therapy school and in my years preparing for that, I began to learn in my clinical volunteer opportunities and experiences that physical therapy also included helping people learn how to walk again. So here I was focused on people learning how to run faster, recover from injuries, hit the baseball harder and farther. And I became completely 180 degrees shifted and enamored with teaching people how to walk again, how to be able to get up to stand and balance themselves again. And the fascination of what we do and don't know about the human brain has stayed with me ever since.
Oh, wonderful. I remember while you're doing that, Mike, I remember when I work in Abu Dhabi, the balance weight trainer. It is a Rio ambulator, and only one of my company in Sheikh Khalifa has that kind of balance weight trainer. So that's really interesting. Every time we engage in neurologic physical therapy, and also the satisfaction that you're able to walk, make them walk, you know, that from SCI, stroke, and you see that kind of progress. And then can you share us your wonderful experience about a certain client that you really cannot forget, that you always keep sharing because you did all your best, things like that?
Yeah, there are so many. So
Sure.
I'll give you one that particularly enamors me still today. A gentleman who had had a thromboembolic shower. So he had a number of strokes all at once, lost the vision in his right eye, lost motor function and sensory function, left arm and left leg. And what's interesting about this gentleman is that he was just 57 at the time this occurred and was gainfully employed as an executive vice president in a credit union, wanted to get back to work, couldn't walk on his own, and could not drive anymore because of the loss of his vision. I was able to work with this gentleman on an outpatient basis. He had already finished the culmination of what he thought was going to be the majority of his rehab, inpatient rehabilitation. So when he came to me, still being quite impaired, he thought he was going to maybe gain a little bit more, but this is pretty much the status of what he had to face for the rest of his life. The gentleman was very well supported by his wife, very motivated and very faithful that when I could demonstrate some gains to him, he was that much more engaged. We got this gentleman all the way back from the point that he needed assistance to walk to the point that he's now jogging as part of his home exercise program, returned back to work, returned back to driving, using his left hand for dual task activities while he's out walking. And he's thrilled. He's probably one of my greatest endorsers and supporters today. And he actually is very frequently mentioning my trademark term, which is called movement in the background. I actually have a US trademark on that term. And that means that he's able to function and think and operate and enjoy the world and do work operations without having to think about his steps every single step. So that's movement in the background. And that's just one case of many over the course of 32 years.
Yeah, and that's what we're doing right now, Mike. Movement
That is
in the
correct,
background,
Dr. Jenny.
right?
Yeah, that's right.
Yeah. So some people will have difficulty in doing this dual tasking. That's what exactly you're doing right now, talking and walking at the same time. And we have that specific test as well, dual cognitive training. And then maybe later on, we will ask Mike to hold the bottle of water while singing with us and everything. Uh-oh, we're challenging him now.
You go ahead. I don't want to distract from the
No,
interview, but I
I'm
could tour
just
these back
joking.
and forth.
All right. Doing that, Mike, can you share us some specific best exercise that you always, as in you don't miss all your clients, you want this as long as they can do it. Things that you always do in your clients, especially something like this, yeah, that you can share.
Yeah, yeah, that's a great question. So
Okay.
one of the things that I want my patients to be able to do is to be able to move without being visually dependent on their movement also. So we just talked a moment ago about not being cognitively dependent on their capacity to pay attention and problem solve, etc., while they're in motion. But another thing, because you bring to the point that might be very interesting to your listeners, is that notion of being visually dependent. So I'll guide you through a quick exercise that's kind of a one size fits all, of which there aren't too many. But I will tell you, I might have an individual stand up and sit back down twice from a reasonable height surface, something just a little bit under 1/3 of body height. Okay.
Okay.
And they'll do that 2 repetitions with their eyes open. And then I say, on repetition 3, I want you to stand up with your eyes open, but sit down with your eyes closed. Okay.
Oh,
So they'll
okay.
do that
Yeah.
then for 2 repetitions, sit down with your eyes closed.
Mhm.
Now we're at repetition 5 because they've done 2 with their eyes open, 2 while they're just sitting down with their eyes closed. Now from repetition 5 to 10, I'd like you to be able to do the stand and the sit with your eyes closed.
Wow.
Now that's usually just enough to give me a couple things, Dr. Jenny. One, it's going to give me the opportunity to understand how visually dependent this individual is. And this is a dynamic balance activity because their body's in motion, right? A lot of times we
Yes.
do eyes closed while an individual is statically standing. That's one thing, but like me here on the treadmill, closing your eyes while you're in motion really compels your brain to know where you are as you're in motion.
Mm-hmm.
The other nice thing is it gives me a way to be able to just gently take this individual and help them see some of their deficits, which causes them to be more engaged in our therapy. Because a lot of people are shocked as to how difficult it is for them to move with a motion that they've already done several times just by flipping the eyes closed. It makes a dramatic difference for them. And when patients have accelerated and informed awareness about their abilities, they're that much more willing to work on them as compared to an individual who's not aware or who is in denial. So a very simple exercise like that can go a long ways.
Wow, that's really good. I always use those high amplitude exercises, and I always included the sit to stand as my initial exercise. But this is really good a step up because I'm doing strengthening and aerobic at the same time. I can do more on the balance because we always think that is strengthening and aerobic in some ways because of the endurance, but I didn't think of challenging the visual and even the proprioception later on that level. So thank you for
Mm-hmm.
sharing with that as well. And then now I'm thinking that this is your unique technique. And then I remember Dr. Tini Mulder. She is more on the reactive balance, just challenging it, and then so.
Sure.
Yes, and we always like to learn from you, especially, and that we can apply the next day. And then
Yeah.
we remember I just saw in your post, Mike, that you shared us like the trail, the dual cognitive task as well. And then you are sharing it, whoever wanted to have a copy and to make it big. So can you explain how does it work? And they can check that in your post on your Facebook, and also most probably in Northwest Rehab Alliance, and also in Balance and Fall Support Group. I shared that as well. What is
Sure,
it
excellent.
and how they can use it,
Yeah.
Mike?
So the trail making test has a part A, which is just using a paper and pencil test to trace from the number 1 that they see on the page to the number 2 to 3, all the way through to 24. Okay? That's the trail making A. Then the trail making B, which has been around for many decades, is going from the number A, and then the user finds, the number 1, and then the user finds the letter A on the page. So they go 1 to A, then they look for 2, and without picking up the pencil or pen, they go to 2. And then they keep it on the page and go to find the letter B, 3, C, 4, and D, all the way through till you get to the letter K, which comes after the number 12. Mm-hmm. So what we've done is we've taken that very well-established, psychometrically informed test, good validity, and certainly good reliability when you're trying to test someone's basically attention shift, okay? Mm-hmm. So we call it alternating attention. Now, and we also know that is changing cognitive set. There's many ways you can refer to that. We took that and we actually made it into an agility-based reporting or an agility-based performance wherein, rather than a paper and pencil, the person's standing on a mat that looks somewhat like a twister board. And they walk from 1 to A to 2 to B and 3 to C. Now we took that and went to the next level with that. And rather than having alphanumeric, we actually have the numbers with the months. And so now we have patients go from 1 to January, 2 to February, 3 to March, and 4 to April, all the way through to 12 December. And so that is another way of interacting. It's practical information. It's something everybody should know, like the order of an alphabet. Yeah. And it really challenges someone to make these agile directional changes while they're also keeping track of 2 different threads, numbers, and months.
Wow, that's really good. Especially this is challenging your balance and also your cognition, guys. And imagine, and also challenging it, the movement and the background. Later on, you will be used to it. So I use the Clock Yourself app, Mike. And it's when you say something about the months, that's a little bit more on the advanced level. And does the color makes an effect on those trails? Did you make a specific?
You can.
Okay.
You can, yeah. If you want to go to higher levels of that same board that we've used, you can utilize the colors as well. And there's many ways to do that. And Dr. Jenny, it's really only limited to the creativity of the therapist that is the user. Because you could imagine, how about this? If I said go from 1 to December and count the numbers forward, but count the months backwards. 2 November, 3 October, 4 September, 5 August. And I had you actually do it that way. So that is, and then you can incorporate the numbers, and you could certainly say, okay, I want you to move, start with red, and I want you to go in order, find the lowest red number, now find, the next order if you want, and go to the lowest green. Now find the lowest yellow, and then find the lowest blue, and then keep going like that until you're done.
Oh, that's a good point. That I'm just thinking that just saying that 1 in January, 2 in February is already a challenge to me. And you want me to make it as a mess more. So that's really challenging. So this is really important, guys, to challenge our client, especially if they have stroke and also for cognitive dual tasking. And I just want to say about neuroplasticity as well. Dr. Mike is really big with this. He had the speaking, is one of the speaker in the TEDx last 2020, and he did a wonderful presentation about what is neuroplasticity. Can you tell us more about what is it and why it's very important for us clinician, Mike, especially if they are treating neurologic cases, Parkinson's, stroke, any other SCI? Go ahead, Mike.
Right, right. Yeah, and I would extend that out into concussion. I would also extend that out into persons that have neuropathy, which that's actually going to blow some people's minds. If you think about it, what we're talking about in neuroplasticity is for the brain to reshape itself and make new connections so that the learner, the user, the holder of that brain can be more successful either cognitively or more successfully motorically or both. So more functional, right? More functional in the things that I want to do. I want to be able to pick up a grandchild and walk with them. So neuroplasticity says, how can we reorganize the motor control system, for one example of a system, so that we can have connections in the brain that are reliable and formidable so that this individual can actually recover from an area that has been robbed, right, in a stroke, and they can actually work around, like road construction, they can actually build a road around that area of lesion. And in the neuroplasticity talk that I gave, the TEDx talk, we talk about the analogy of neuroplasticity being like road construction. When you see a road closed sign, you have to find an alternate route. And Dr. Jane, that's probably the simplest thing that we can say about neuroplasticity is the ability to build an alternate route and then repave it so we can travel on it very easily again. That can happen because of stroke, and you think road closed. It can happen because of a concussion, and maybe you think like an earthquake shook the road and broke it up. And we have to actually build a lot of connections because there's a lot of roads that are in disrepair now after connections are shook and violently traumatized in a concussion. And so that's what neuroplasticity is. And if you look at it physiologically, it's actually that neuron growing a new axon, reaching that and making that synapse, a brand new synapse that they had never made before because they see that there is some success and some benefit in making the new connection.
Wow, that's really good. Especially it's a good explanation to our clients who's having a rehab, especially when they have stroke and SCI. So nerves regenerate, we keep telling them. So it gives them hope and everything. But is there a specific time frame, especially your stroke specialist as well? You have many cases in doing the stroke. We keep saying about engram formation, which is more on neuroplasticity. Is there a specific time, Mike, that we can say them that this is your gold standard? Because I had read an article before they make it only 6 months, and now we keep saying that even a year nerves regenerate, and you keep gaining and improving even after the 6 months gold standard, golden
yes
standard.
Yeah, now it's been well proven that individuals that have sustained a stroke can actually make neuroplastic changes that can be seen on an fMRI, a functional magnetic resonance image. You can actually see structural changes after aggressive, intense rehabilitation more than 5 years post-stroke.
Wow.
Yeah. So they've proven it at least that far at this point.
Yeah. So that's really good. So we really need to make them keep doing their exercises. We want them really to have that acute rehab on the first 6 months, a year, and then let them know that nerves regenerate. You really need to keep doing it. And then because of these studies, they give them hope that whatever contracture or weakness that they have, it can be better. We need to maintain those tones, we need to improve and to prevent atrophy. So this is neurology to make them functional. So that's really, really, really interesting, Mike, because every year we have evidence-based research, evidence-based articles that we learn that we can apply. Do you have any specific in MedBridge? Do you want to share anything that you want to, our clinicians to check out. That way we learn more. What are you discussing usually? I know geriatric
Sure.
and neuro, right?
Yeah. So I've got, I think, 6 courses up on MedBridge now.
Wow.
I will tell you that the most popular ones I've got are classes about dual tasking. So I've got one that could be easily searched on MedBridge on dual task. Specifically for your audience, I've got one entire class on geriatrics. It's called geriathletics.
Okay.
So because I coined that term in 2007, geriathletics. And then I've got another course that I just recorded with my colleague, Julie Hirschberg, on functional neurologic disorders. That was just released in early December. So functional neurologic disorders means that a person doesn't have a problem with their brain, but because of life circumstances, stress, and etc., they are demonstrating a functional movement like a tremor, or perhaps passing out, or seizures that are non-epileptiform seizures that are due to a functional disorder, basically the software operations of the brain. So those would be probably the top 3. I'm getting ready to record one on recovery and stroke, specifically on arm and leg evidence. And then I'm going to record one on behavioral economics. But that culminates probably my most popular course on MedBridge is helping therapists to examine and differentially diagnose Parkinson's disease from Parkinsonisms, and to understand all the different Parkinsonisms, and then to figure out what's the individualized treatment for each one of those. So Parkinson's disease versus Parkinsonism, that's probably my most popular course now.
Oh, that's really interesting. I like those things. Especially we have many clients that looking forward to do their neuro NCS or certification in neuro. So this is a really good review material for your practice, and at the same time you can read this. And MedBridge has a very good we have those NCS exam review materials too. So that's really good. And this is, I always ask them, it's my motto, like invest in yourself. I always attended lots of courses, certification, because I always want to improve myself. That way I was able to serve my clients. And the same thing, you have lots of wonderful courses, and you have lots of speaking engagement, Mike. And then do you have any speaking engagement coming up this coming year?
Well, yes, I do. I think I have 26 speaking engagements that are anywhere from 2 to 13 hours in length. I have 3 in January. I'll tell you about a funny one in January. I don't want to take up too much of your time. On January 20th, I'm going to teach a 3-hour course. The first hour is going to be on stroke. The second hour is going to be on Parkinson's disease. And the third hour is going to be on total joint replacement and back surgery. I'm going to do that, Jenny, and now this probably won't surprise you now, while I'm running on an underwater treadmill.
Underwater
treadmill, yeah. And now here's the tops it all. When I run this, I'm going to run it for an entire marathon, 26.2 miles on the underwater treadmill, and I'll break the world record. If I do it all right, I'll break the world record for the fastest underwater treadmill marathon while I'm teaching the course. That's on January 20th.
That's amazing. I read that the underwater. I forgot to tell them about it. See, I told you we missed something. Yeah, because I read that Mike, that you did like the underwater. You're an athlete and as well, and then you're trying to break that. How do you do the underwater?
It's right at about sternal height.
Okay.
Just right under my armpits, right there, and it's much easier to run an underwater treadmill marathon than it is a land-based marathon, which is why I'm able to do a continuing education course while I'm doing it. But yes, I own 4 of those in the buildings that I own for our clinical practice. And then I'll just add one other thing, not to list all the courses that I'm teaching next year, but I will be locatable at Combined Sections meeting for those people that are going. I teach 1 2-hour presentation for the geriatric section. with
Okay.
my colleague Tiffany Schubert on behavioral economics.
Yes.
And then I teach one 2-hour course with my colleague Julie Hirschberg and Chelsea Richardson for the neurology section on autonomy as a part of the optimal theory of motor learning.
Yeah, I spoke with Dr. Tiffany, and then she told me about that you work together in this website right now, and then you have that kind of educational materials, things like that. So
Yeah.
that you're so busy, Mike. And then why do you think that you prefer more on walking and running? What is the benefits? Why you think that I really need to do this every day? I don't want to miss this. What's the benefits that you keep thinking on mind that you need to do this?
Before I even read about the research articles that talk about the mental benefits of endurance exercise, sustained endurance exercise, and those mental benefits being release of dopamine, release of endorphins, reuptake of serotonin, those things. So really it's an antidepressive, of which I have no tendencies, but that's good. Maybe that's why. It's a mood elevator, and it's a cognitive stimulator. And so even before I read those articles, I was already feeling and experiencing those things, which led me to be that much more addicted to running. So Dr. Jenny, I like the way it makes me feel mentally when I have run. I like the way it actually makes me look as I'm trying to age. I'm really hoping to be able to, continue to keep my body weight in check. And I like the thrill of competition. So being able to run a marathon to try to compete against my own times when I was younger, to compete against other individuals that are my same age group, I'm thrilled to compete in a very collegial manner in that way.
That's really good. It's an eye opener for us because you are doing and maintaining this, and we on our active aging time, some of us are really not thinking in that we need to do this, feeling that we're okay, But if there's no age, whatever strikes you, keep doing it and begin. That's what we always say. And the oxygen, the more you do the exercises, it can also prevent the dementia, the risk for dementia, because of the increase in oxygen overall in the body and then transmit to the brain. So there's lots of good circulation going there.
Yeah.
Exercise is medicine.
On that point, I'll tell you one thing, just real quickly.
Go ahead.
An individual who is at genetic risk for Alzheimer's disease because they've been tested and demonstrate genetic risk is 2.5 times less likely to express Alzheimer's if they can be moderately to highly active continuously throughout their life. That's one thing right there. And the second thing is, Dr. Jenny, you did such a great point of talking about the oxygenation, right? So we improve what's called angiogenesis. We create new blood flows in those areas when we do that. But we have to remember there's two other things. When you exercise to a moderate to high intensity level, you actually improve the capacity for neuroplasticity, brain-derived neurotrophic factor, a protein that's basically a fertilizer for brain connectivity. And then we really also understand that we do a better job of clearing beta amyloid, which is one of the main buildups, right? We do a better job of clearing when we have engaged consistently in exercise and we get a healthy night's sleep.
Yes. So remove that plaques. You will prevent those beta amyloid plaques.
That's great. You've got it.
As if you're so upset with the plaques. Yeah.
Yes.
So what keeps you moving? Why you need to keep doing this? What inspires you other than, want to be an athlete, you want to be fit and everything? So
yeah. The thrill of innovating, Dr. Jenny, of being able to create a new technique or treatment and rehabilitation is very meaningful for me. The thrill of communicating what I've learned about the nervous system is really stimulating for me as a presenter. And the thrill of actually explaining and conveying that and conducting it straight to one of my patients who's in need is also very thrilling. And the final thing I'll say is, because we still don't know a lot of things about the nervous system, I am continuing to be moved and motivated by that.
Thank you so much. So guys, we heard Mike, those are wonderful. What's your last message for all of us, Mike? So for the clinicians and the clients that listening to you. Thank you.
I'll tell you, the last message that I've got is never stop learning. Okay. When you have the opportunity to amass new knowledge, just like our leader here, Dr. Jenny said, new certifications, new courses, never stop learning, and look for ways to be able to integrate and apply the information, because you get a mental health benefit from being a caregiver as a rehab professional, and you actually continue to also improve your mental faculties so that later on in life, you've got your mental capacities, cognitive function way up here. If you start to lose a little bit of that because of an organic or an inorganic trauma, look at where you started. Get your cognitive fitness up and benefit other people along the way.
Wow. Cognitive athlete. Wow. We'll make that.
There you go.
You're a Jerry athlete now. We have one member in our Global Health in Aging, Becca. She's focusing more on senior athlete. And you're saying that about the Jerry athlete. That's amazing.
Now, that wouldn't happen to be Becca Georgia, would it?
Yes, that's Becca.
But she's a very good friend of mine. Yeah.
Oh, that's why you're interrelated with the focus on Jerry athlete, because she is the one focusing on her studies. That's majority of her subjects, the senior athlete.
Yes.
That's why.
Yeah.
I remember her when you said.
In 2000, let's see, I think it was 14, I actually volunteered for the Oregon State Senior Games, and I conducted the senior athlete fitness examination, which is actually the main invention of our colleague, Becca Georgia.
Wow. Yes. That's what she's focusing on. That's amazing. See, we have a small world, guys. Surround yourself with positive, great mentors that we can boost ourselves and learn more. That way we can learn every day and share to our clients. So it benefits us and benefits our clients as well. Thank you so much, Mike. And we are so fortunate to learn great things from you. And we will be looking forward for all your courses. You're so busy person and you don't miss your exercise, even you're doing that. And that's amazing. It's a first speaker who's doing this, right? Other speakers, they keep moving from back and forth. They're really active. But this is like doing up and about. That's really good.
Very good.
You practice what you preach, Dr. Mike. So thank you so much.
Thank you. Yeah.
You're welcome. Yeah. How can we connect with you? Any emails other than MedBridge? We will post all those links once we post this. And how about your emails or any other connection? Sure.
Very easy to reach me, and I'm very responsive by email. So it's just my first name, Mike, and then it's and it's all one word with all of the directions spelled out, northwestrehab.com. So it's Mike at northwestrehab.com. And my website is another good way to connect with me and see what I'm speaking about. And that's just my name, MikeStuder.com.
That's all easy, guys. And you will see all the different courses and speaking engagement with Dr. Mike. And he is a big person in geriatric and neurologic field in academy. So we're always learning, more than 30 years of practice and experience. Thank you so much, Dr. Mike. Thank you so much for your time. And we really appreciate you. So guys, if you have any questions and would like to connect with Dr. Mike Studer, connect with us. And then we will going to post all his emails and also his different courses in MedBridge and links. So it's me once again, Dr. Jenny. That's another amazing talk with our innovator, entrepreneur, therapist, clinicians, educator. If you have any concerns, connect with us with Balance and Pulse Support Group. It's me again, Dr. Jenny Yusuf, your physical therapist and geriatric clinical specialist. Have a great day, guys. God bless. Bye for now.
Happy New Year, Dr. Jenny.
Happy New Year and have a great 2022, guys. Bye for now. Take care.
Take care.